This podcast is not intended to be a substitute for medical advice. Listeners are responsible for their own health choices, as well as whom they choose to help with those choices.
Welcome to the Tag Team Podcast. Our mission is to educate, inspire, optimize, and advance the well-being of your life at every level. Join us now and discover how to be better. What is going on, everybody? Dr. Tim of the Tag Team here, and I'm with my beautiful wife, my fellow practitioner of 24 years in private practice and almost 30 years of marriage, Dr. Cathy.
Hello, everyone.
Isn't she sweet? I always forget that this is also an audio podcast, but folks, you can also watch this on YouTube. So you can listen or watch it. So when I'm referring to my beautiful wife, you can see her if you go to YouTube. But anyhow, we are not here to diagnose, treat, or to give any medical advice. We are here to educate, inspire, optimize, and advance your life and the lives of your moms and dads and uncles and kids, babies and co-workers, humanity. That's what we do. And we do that all day long. And today we're going to just have a conversation. We're just going to address a few things that we talk about with each other because we're always learning. Dr. Cathy and I are constantly learning about health, and we go deeper and deeper and deeper into how the body works. Like I said in a previous podcast, we're like detectives of the body, and we gather as much data as we can, as much information as we can to optimize and advance health and life. So what I'm going to do is I'm just going to let Dr. Cathy start this podcast, and then I'm just going to chime in and say my stuff. So Dr. Cathy, you go right ahead, sweetheart.
Well, welcome, everyone. And today I want to start out with talking about the power of agreement. Power of agreement. We make agreements all day long. We go to the grocery store, we buy our groceries, and then we agree to pay for them, and then they let us take it home. We have agreements with mortgages, credit cards, other agreements in life that we're pretty much familiar with. But we're going to talk about some agreements that you may not even realize that you are agreeing with when it pertains to your health. So I'm going to give kind of a common scenario, not as common as it once was, but especially when we started our nutritional journey, I would have patient come in and I knew that there was so many things that could be done nutritionally for the patient. And I'm so excited to get this in their hands and have them have an experience. And sometimes I would get, it's just too expensive. It's just too expensive. I'm not going to be able to do it. And so, um, I don't consider myself a salesperson at all. I'm constantly looking out for the benefit of my patients and I try to show value. And I realize that our current system for health, which I really consider sick care, um, it doesn't really have the tools necessary to actually help us achieve health. So I have to show the value of another choice. I have to help them consider another agreement. And so I would kind of methodically sit with them and say, okay, well, we tend to have money for what we prioritize. And I'm not trying to get into your finances at all, but let's just review how the other system's doing. And we would go into, okay, so we have this thing called health insurance. That's an agreement. And that agreement requires usually a monthly payment. And I get it. Not everybody can pay for it themselves. And a lot of people have employers that will help pay that expense. But especially since 2008, the insurance change around that time shifted and deductibles began to be huge. And so maybe before then, someone might have a $500 deductible or a $1,000 deductible for their plan. And then the agreement was with that contract that once that deductible was met and they paid that money out of pocket, then the insurance would pay for all the healthcare services. Okay. So you have the healthcare contract where a lot of families are paying thousands of dollars a month for. Let's just be honest. Okay. And then they're having like $5,000 deductibles, $10,000 deductibles. And so even if someone had coverage for even the chiropractic care, forget about them paying for the nutrition. They've never paid for nutrition. But even if they had chiropractic care and they were a patient that had gotten chiropractic care, they would never meet that deductible in our office for a year's care. So people have to pay out of pocket. But what if they were able to say, okay, my goodness, I'm paying thousands of dollars a month for my insurance. And what am I getting back? Are they getting anything back? Maybe if something catastrophic happens, God forbid. Okay. But the agreement with that system, we're not getting everything that we should be getting, so to speak. We're not really benefiting from that. And an example is, let's say you go into the hospital or another healthcare facility and you did have an emergency. And the people there can assess your insurance and we can see, well, what does this cover? And I will tell you, the people that have the best insurance usually have the most interventions because guess what? The insurance covers it. And so interventions, sometimes they're necessary, sometimes they aren't. We know of a lot of people that have not benefited from interventions. And supposedly, this great contract that they have, oh, it's covered. Great, it's covered, but is it what you need? So, Dr. Tim has some stats about what we are agreeing to as Americans, like what is actually happening with our health. And you could say, well, I don't agree with that. Well, I hope not. But this is the trend and these are the numbers. So whether we're agreeing about it on purpose or whether we are just ignorant to it, I hope that you can take this information and say, I don't agree with that. And then just kind of sit back and do a self assessment and say, okay, well, I don't agree with that. And then maybe you don't necessarily see a way out, but there's always a way. If there's a will, there's a way.
So, Dr. Cathy, what you're saying is whether it's a credit card or a mortgage or a car payment, it's an investment, right? And
Yes.
when you invest in something, you want to have, like you said too, we want to show value to the patient, to our patients. And when it comes down to that, and it's like people, they're all about the system. They're told what to invest in, but they don't want to invest in their body. It's at the bottom of the list when it comes to, cash out of their pocket. But I'm gonna address a few things here and show you in reference to our current healthcare system, kind of where it got us. And I said this in a previous podcast. In 2020, there's a study out there, and 90% of the U.S. corn and soybean and cotton supply, in fact, they're all above 90%. They're all genetically modified, bioengineered. And when you think about it, it's like, okay, you have corn, so everybody's eating corn. Corn is in a lot of stuff. Corn syrup, high fructose corn syrup. It's like sugar on steroids. It's these long molecular chains, and as soon as you put it in the body, it stresses the body out. But not only is it stressing it out because it's so hard to break those chains, it's genetically modified. And then you got the cotton. Where do you think cotton? What do we use for cotton? Clothing. Now, a lot of people are wearing, a lot of our clothes now are made with plastic. They take plastic and they process it and they make fibers. And that's what a lot of people are wearing on their body. So you're wearing bioengineered clothing directly on the skin, and the skin absorbs everything we put on it, folks. And it'll change your physiology, whether good or bad.
Yep, the skin is the largest organ.
And soybeans also. People are like, well, I don't eat soybeans. Well, where do you think vegetable oil comes from? It's not vegetables. It's funny. You look at the labels, and they have like a tomato on it, or they'll have like a piece of celery, but it's soybean oil, genetically modified soybean oil. And that's a whole other thing. I can get into the oxidative stress that it causes, but that's another podcast. This is kind of just a conversation that Dr. Cathy and I are having. And I also mentioned this, and I'm going to mention this over and over again in podcasts, folks. In 2018, the University of North Carolina Gillings School of Public Health, look it up. Only 12% of Americans are metabolically healthy. And when you're metabolically unhealthy, it means there's some obesity, you got some diabetes going on, some type 2, and you're prone to cardiovascular issues. So back in 2018, 88% of Americans are not metabolically healthy. And you look at that and it's like, how does our country even survive with that? And metabolic health causes a lot of issues. When the gut's not working right, when your gut isn't processing right, that's where you get a lot of these mental health issues. It's not always in the brain. A lot of it's coming from the gut. And then as of current, the United States, Dr. Cathy, we spend $4.9 trillion a year on healthcare. 4.9 trillion.
So we should be the healthiest nation ever, right?
Yes, annually. But here's the problem. 90% of that 4.9 trillion dollars is going towards chronic disease. That's a problem there. Because the majority of these complications, and again, I'm not here to diagnose, treat, or to give any medical advice, but a lot of those are preventable. And then another one we have here in 2023, and this was from the CDC. 76% of Americans have at least one chronic disease. 76% of Americans back in 2023 had at least one chronic disease. And the majority of that percentage has two or more chronic diseases. But here's one of the clinchers. 6 out of 10 young adults have a chronic disease. Young adults, folks. Young adults. Midlife adults, about 8 and 10, and then the seniors, 9 out of 10 have a chronic disease, Dr. Cathy.
Yeah, what have we been agreeing to?
Exactly. In previous podcasts, we talk about you need to pursue things, folks. You need to pursue other options. I'm sorry I get a little bit passionate when I start talking about this because these are my fellow Americans. I'm a United States veteran. And I gave an oath to support people, to support life. And when I see this stuff, but it's encouraging because people come into our office and they get under care and they're like, Dr. Tim, I'm feeling better. I haven't felt this good in my whole life, oftentimes. What can I do next? Tell me more about this dietary stuff. Tell me more about this weight training stuff. So those are some statistics, Dr. Kathy.
Yes. And so, we see people all day long that are actually seeking an alternative. And some people have even made different decisions to not go with the flow with, let's say, the insurance model. There's a lot of different ways you can handle it. And I have found that even if someone has insurance with a high deductible, sometimes they have HSA accounts, which is an amount taken out of your paycheck, and then you can use that money toward healthcare services. And I've seen a big shift in the use of those dollars to be utilized with us, which I'm so thankful for, and they're so thankful for. But I've seen a few people even go further than that and say, I was going to pay $2,500 a month for my healthcare insurance. And they just decided that they're going to put that in an account, let it grow, and then take out when they need to based on what they are choosing to do for their health versus, oh, I have to pay that every month. I don't get anything back except for, oh, yeah, if I'm in a catastrophe, they'll pay my bill. And we shouldn't be looking for the catastrophe.
Right, but that should be what it's for.
Yes. Yes. So,
Because people they're paying all this money and they come in and they're like, "Dr. Tim, I'm not any better." And I tell them what I say on the podcast because you're doing nothing to boost and to restore and support your health. And that's why you're in our office, because that's exactly what we are going to do.
yes. And so, that's the financial side of things, agreement on that part of it. But just to give another perspective on health, did you ever think that the reason why your body may be having symptoms is because something in your body isn't agreeing? Meaning, we were meant to be healthy. And if something isn't quite right, those symptoms are an expression of the disagreement. I mean, you can hear people say, "Oh, I ate that, it didn't agree with me." That's pretty easy concept. But we were made we were made in God's image. We were made to be healthy. We were made to tell the truth. And the disagreement that is being expressed by the discomfort or the pain or whatever the symptom may be is because that is not lined up with who we're supposed to be. That is incongruent with how we are made. And the body is letting you know it's pretty upset about that.
Right. And also the American diet, everything I talked about, and so much more. Again, every day we come in contact with herbicides, pesticides, insecticides, genetically modified, bioengineered food, glyphosate. The food dyes, which I heard they're getting out of our food supply here pretty soon. Thank you. Electromagnetic frequencies. There's all these things. And like I said in a previous podcast, this is not a fear talk, folks,
No.
but there is hope and you can be healthy in this modern age. And Dr. Kathy and I were talking this morning. It's like, and you hear this a lot in health and nutrition workshops. A lot of times, the majority of poor health comes from too much detoxification or too much toxicities in the body and deficiencies in the minerals and the nutrients. That's a whole other podcast on its own, but we need to get rid of the toxicities. We need to get the bad out and we need to get the good in. Because when you get the bad out and the good in, that's where you're boosting and restoring and supporting health. Let's talk about the liver for a second. The American diet, the American diet and a lot of other things, you'll hear it on commercials where if you've had a previous liver problem, that's as far as I'm going with that. But the liver gets hammered by living and consuming in the United States. And folks, our liver, it detoxifies our body. It synthesizes proteins. It does a variety of things. It produces bile. Bile breaks down fatty acids. So when we eat food, we need bile to break down the fatty acids in our food. So when it gets into our gut, we can assimilate the nutrients. Well, here's another issue. We got the gallbladder. When the liver, the liver also, this is another thing. This is something a lot of people don't know about. There's areas in the world, and they're called blue zones. Blue zones are high concentrations of people, centenarians, living to be 100 or more. And they all have high levels of glutathione. So guess where glutathione's produced, Dr. Cathy?
Is it the liver?
It's the liver. So we're hammering this organ in our body, and it's having all these issues, detoxifying, synthesizing proteins, which is a big deal, creating bile, and creating glutathione. But on top of that, you have the gallbladder. When the liver creates bile to break down fatty acids in our food, it's stored in the gallbladder. And it's not just stored, the gallbladder takes and it concentrates that bile. And a common thing that, we witness in the United States because of the agreement you're talking about and the investment, a lot of gallbladders are removed. We've had some pregnant patients over the years, and they said, well, when I think they had C-sections or something, and they said they took out my gallbladder while they were doing it. Okay, well,
Right. It was just like, oh, we saw stones, so we just decided to take it.
Again, the gallbladder, it's a highly, highly important organ because it concentrates that bile. The liver secretes it, stores it in the gallbladder, and then it's concentrated. So it can help break down those fatty acids. And then we have our gut. Our gut, we just, of the American diet, we hammer our gut. I'm not going to get into the Bible too much, but the Bible talks a lot about when you pray and fast. And when we fast, our gut literally starts to clean itself because all we do is gobble, 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 drink, 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 gobble, gobble. And we get this, number one, it overworks the gut, but it also, it creates a layer of gunk. So our gut can't assimilate what we get out of our food. It can't assimilate the minerals and the nutrients and all the components we need to survive and to stay healthy and strong. So,
Sure. So we're moving in a place where maybe you didn't know these things. A lot of people don't know these things, but it's really important to wake up. Think about where you're getting your next meal. Are you getting another processed meal through the drive-through? Um, what is in your food? You need to be concerned about that because there are other options. There are cleaner options. And I was having a conversation with my girlfriend one time, and we were talking about just all the things that were in the food. And, we're like, this is like poison in the food. And that might be glanced over and not to be rude or gross or anything, but she made it funny. She's like, well, that's just saying, like, yeah, we're going to give you this food and I'm just going to put a little bit of poo in there. Just a little bit, not much,
not
just a
much.
little bit. Right. But would you want to eat something with a little bit of poo in it? I wouldn't.
It's so funny.
But you can remember, right? If you put it into perspective, like, okay, your chemicals and,
Yeah.
herbicides, pesticides, you can glance over that because that is pretty common. But if you really think about how detrimental that is for your body to be consuming something like that, if you had that perspective of like, oh, this is equivalent to poo, maybe you wouldn't eat it.
Right. Right. And that's why people love, like I always tell Dr. Cathy this, they like Dr. Tim. but they love Dr. Kathy. She does this in the office all day. She is so funny. I hear laughter all the time coming out of that nutrition room of hers. But yeah, she's exactly right. They say, well, yeah, there's some of this and there's some of that, and there's a little bit of aluminum, but it's not enough to be toxic. Yeah, but there's still aluminum. And with what we do in our office with the biofield testing, a little bit of anything can be a problem. And I'm gonna address, here's 5 things you guys folks you can do to start your path to health. And number one, you want to stay hydrated. Try to get at least a good quality 20 plus ounces a day of water. Just every time I ask patients, you drinking enough water? Yeah, I am. No, you're not. So again, try to get at least 20 to 24. Again, you don't need a half gallon of water. Okay. But just stay hydrated, folks. Get some water in your system. Sip on the glass.
And know that for everything that's not water, you need to drink twice the amount of that amount to hydrate yourself.
Right.
So if you have like 2 cups of coffee,
Yeah.
then you need 4 cups of water just to stay hydrated.
Yeah. Coffee and soda, you can't get because people, they tell me that. It's like, well, it's a diuretic. So you're actually removing more water by drinking that than the water you're getting out of it. So drink good, clean, fresh water. But folks, number 2, intermittent fasting. Okay. Intermittent fasting is where you don't eat 16 hours out of your day. Okay. So you got 24 hours in a day. You don't eat past 7 or 8 PM at night. So after 7 or 8, no snacking. You can drink water, but you do not eat anything until 11 or 12 o'clock the next day. And you just did an intermittent fast. And you're not going to get all the fasting, symptoms, because when you go on a true fast, your body's detoxifying. It's kicking out all the stuff. And the first couple of days, you're almost euphoric and you get sensitive. And some people break out in sweats. But after that first 2 or 3 days, you're glowing. But the intermittent fasting won't do that. I recommend doing that at least 1 to 3 times a week. And all you got to do is don't snack after dinner, skip breakfast, and don't eat until lunch the next day. Number 3, eat smaller meals. Chew your food to a pulp, by the way. Take your time chewing food because as Americans, we just gobble, 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 gobble. And we don't chew our food. We gotta slow down. We gotta chew our food down to a pulp. Number 4 is get some exercise. I mean, even just walking, we need to move. We need to move our muscles and our joints. On each one of the joints in our body, there's these things called proprioceptors. And these proprioceptors tell our brain that we're moving. And it's not just for cardiovascular and muscular, but it's good for our cognition. It's good for our brain. And then number 5, get some sleep. I know. Turn off that phone. Turn off that TV. A lot of times they're showing a microcosm of what is going on in the world. Okay. But again, I recommend try to get to bed by 9 or 10 if you can. And you know what? Turn everything off, dim your lights for like an hour before you go to bed. You'll start to sleep. You start to get sleepy. And then your body's going to it's going to get you out of that little fight or flight. And you're going to get down into that parasympathetic sleep and healing mode. So those are 5 things to start. And then Dr. Kathy and I, we have the virtual care. We do care in our office. And we can help with all the getting rid of the toxicities and all and advance and add the nutrients and the minerals. We can get rid of the deficiencies and add all that to your body. And we also, it's funny because Dr. Kathy and I, we go deep into the body. It's like, how is your biophoton health? How is your astrocyte health? Astrocytes are the most numerous cells in the brain. And there's a way to keep them healthy. How is your neuropeptide health? That's what we do. Again, we educate, inspire, optimize, and advance folks. And our main goal is to boost and restore and support health. And we want to see people get on with their lives. We've seen way too many people just destroy their lives. And now a lot of them aren't even here with us anymore. Because they didn't choose that. They didn't pursue that. They didn't choose these other options that are available to boost and restore and support. So there I am. I'm getting passionate again, Dr. Kathy.
Nothing wrong with
what?
that.
When I get passionate, I'm just going to hand it over I'm going to have Dr. Cathy close us out.
Well, everyone, I'm going to encourage you to do a self assessment of all the contracts, of all the agreements that are going on in your life, and think about which ones are producing fruit and which ones aren't. And for the ones that aren't producing the fruit that you would like to see, if you try to figure out a different way, and if you can't see one, then ask God to show you because He's faithful to do so.
Fantastic. Check us out on, you can listen to this podcast on all major streaming networks. You can watch it on YouTube. Um, Follow us on our social media. We're on Facebook, we're on Instagram, we're on X, we're on TikTok, we're on YouTube, and we have reels and shorts and little 5-minute clips. So, support us and follow us. Go to our website, tagteam.com. We have a bunch of information there. We have virtual care. We do a lot of great stuff. Because, folks, we want to see you get on with your life. All right. Until next time.
We hope you enjoyed our podcast. Visit tagteam.com to enroll in virtual care, purchase products, or to contact us. From our team to your team, may you be blessed with quality of life and quantity of years.